Okay, I think I got it this time. Welcome to Mountain View Hospital, otherwise known as my room. My name is Paulina Smith, and this is my central line trach care checkoff. These tables are really short. I'm really tall. I'm going to try to get my face in it as much as possible. These are my orders. And I will go ahead and begin. If I'm looking like this, sometimes I'm checking to make sure it's recording. Okay, so I'm going to begin. So first thing I'm going to do is check my physician's orders, check for accuracy. I'm going to look at my patient's information. So my patient is Wanda Chi, date of birth September 20th, 1950, no known allergies, and my doctor has ordered a tracheostomy care Tuesday, Thursday, Saturday, and PRN as needed using normal saline, suction to bedside and suction tracheostomy as needed, central line, sterile dressing change every 7 days and as needed. So my physician has also ordered a blood draw through the central line for today because we want the most updated labs. So I can go ahead and go into my supply room and gather all my stuff that I need. And as I'm gathering my supplies, I'm checking the expiration date, making sure nothing's tampered with. So for my central line dressing change, I will grab my central line kit, my bio patch. For my tracheostomy, my tracheostomy tray, suction kit. I'm going to grab clean gloves, extra pair of sterile gloves, normal saline, alcohol swabs, a pin, and I'm also going to prime my caps for my blood draw, grab proper containers I need for my blood draw, and then I'm going to grab my little imaginary measurement stick for my central line. So now that I've done that, I am ready to go into the patient's room. So, okay. Hi, my name is Paulina Smith, and I'm going to be your nurse today. And first thing I'm going to do is perform hand hygiene. And then I'm going to go over to my patient and identify them using 2 identifiers. So I'm going to look at their armband, and can you tell me your name and date of birth? Okay, Wanda Chi, September 20th, 1920. Perfect. And do you have any allergies that I should know about? No? Okay. And so I've identified my patient, and so now I'm going to go ahead and explain why I'm here, what I'm doing, the orders I'm supposed to carry out. So today I am here because I'm going to do your central line dressing change. And when I'm done with that, I'm going to go ahead and do a blood draw through your central line. Your doctor wants updated labs, so I'm just going to pull that blood from that line that's already there, and we can get those sent off to the lab. And then I'm going to go ahead and suction your trach, and then we'll change the dressing around it and clean it up a bit. And do you have any questions or concerns about anything? No? Okay. And so normally I'm going to move from least invasive, which is central line care, to most invasive, which is trach care. I do, however, want to assess my patient for obstruction of the airway. That's something I want to do when I first come in. If they're having a hard time breathing, I want to address that now due to their secretions. I want to take care of that now. However, my patient is fine. So I'm going to go ahead and start with the central line. So now I'm going to provide for privacy. I'm going to raise the bed to a proper height, put down the handrail if needed, and go ahead and set up my tables, disinfect my tables, and have my waste bin ready to go. And now I can begin. So I'm going to start with my central line dressing change. So I'm going to go ahead and perform hand hygiene and put on gloves. And these are a clean pair. And first thing I'm going to do with the central line is I'm going to look at the dressing. So I'm going to be looking for signs of infection, redness, swelling, tenderness, any drainage, purulent drainage, noticing the smell of it if there is a smell, just generally looking at it to make sure it looks okay. And once I've done that, I'm going to measure it. So I'm going to take my imaginary measurer, measure it, and I'm going to compare it to the last measurement taken by the last nurse. We want to make sure it hasn't migrated out. If it has, I need to let the physician know. But the measurement, 5 inches, is the same as the last measurement taken, which is good. So I'll go ahead and make sure I document that later. And so now that I've done that, I'm going to go ahead and come to my central line packaging, and I'm going to go ahead and open it. Now this is a sterile procedure, so I want to make sure I'm very careful because I don't have my sterile gloves on yet. So with the packaging, I just want to touch on the margins. I'm going to open it. Okay, and being very careful, it's very folded in there, so I want to try to touch just the margins if possible of the bag. There we go. Okay. And so now I'm going to grab my bio patch. The packaging is not sterile, however, the bio patch inside is sterile. I'm going to drop the bio patch into the package. If I can get it open. Not easy to do when you have gloves on. Can't get it open, so try a little. Can't get it open, so I'm going to take off my gloves, perform hand hygiene, and open it. Being very careful not to touch the inside or the bio patch because I don't want it to not be sterile. So very carefully, without touching anything on the inside. It's not going to come out. Try to open it a little bit more. Still not going to come out. There we go. Okay, so sterile bio patch is in the sterile packaging. And I'm gonna do hand hygiene, put on a fresh new pair of gloves. I don't have a ton of these gloves, so I have to use the same ones, but we'll pretend it's a new pair of gloves. Make sure it's not recording. Okay, and so now I'm going to put on my mask. I'm gonna, again, these gloves are not sterile, so I'm just going to pinch the mask without touching anything else. Okay, because I don't need this anyways. And I want to put on a mask, and I'm going to have my patient also put on a mask or turn the other way because I don't want them or me to breathe onto the central line, especially whenever the dressing is off, because that could potentially cause infection. So now that my mask is on, I'm ready to actually take off the dressing. So what I'm going to do is I'm going to be very careful not to yank at the central line because I don't want it to migrate out. So I want to hold it in place as I take the dressing off. And I want to be very careful when I'm taking the dressing off. I don't want to harm the skin. And again, I want to be very careful with the central line, keeping it in place. And use an alcohol swab if need be to help get it off. Keeping that hand anchored. Okay. So now the dressing is off. I can take that off, And I'm going to go ahead and wrap up this dressing in my gloves and throw it away. And then I'm going to perform hand hygiene. And I'm ready to go ahead and put on my sterile gloves. So I'm going to very carefully go into my sterile kit and grab my sterile gloves without touching anything else. And just touch the margins. So my sterile gloves, and now I'm going to put them on. Okay, so put on my right one first. And it's stuck to the other glove. I can touch the sleeve of this one to take it apart. And go ahead and slide my hand in here. I don't want to touch the outside of the glove because then it won't be sterile anymore, but the inside is okay because it's going to be against my skin anyways. Okay. And so now I can put on my left one, and I'm going to go under the cuff. I want to get underneath there. I want to make sure I don't touch the outside of the glove, or I mean the inside, excuse me. Then I would need to start this process again and get new sterile gloves if I did that. Now I'll step back, and then I can slide my hand in there. Okay, sterile gloves are on. This is in the center, it's still sterile. Okay, so now what I'm gonna do is I'm going to use this hand as my sterile hand, this hand as my dirty hand. So with my sterile hand, I'm gonna reach into my sterile kit and grab my sterile prep, and I will activate it. And I'm gonna, like I said, use this hand as my dirty hand. So once I touch the central line with this hand, it is no longer sterile. And I'm going to hold the central line in place and also lift it up as I clean around it. And for 30 seconds, I'm going to clean on and around my central line and just scrub it. Going inward to outward, just scrubbing pretty vigorously and being careful not to touch my sterile hand to the central line or anything that isn't sterile. So once I've done that, it's clean. I'm gonna let it dry for 30 seconds. I can go ahead and throw this away. And so now I'm ready to go ahead and put on my bio patch. So with my sterile hand, I'm gonna grab my sterile bio patch, and I'm going to make sure that it's opened. And I'm going to go ahead and lift this up and very carefully slide this on. Okay. And so my bio patch is on. I'm ready to put on my Tegaderm. So I'm going to grab my Tegaderm. I can go ahead and use 2 hands now. I'm going to take off this top part. And I'm going to cover my central line now and secure it in place. And I'm just going to pat it down, being very careful not to yank at the line. Pat it down, and once it is secure, I'm going to go ahead and take the white part off. And with this white part, I'm going to write my initials, the date. I don't even know the date, it's August, so 08, good. I don't know what date it is, but once I have done that, I'm going to take this label off. And without obstructing the view of the central line, I'm going to put this label clear. So the next nurse who comes knows when it was changed. And we are done with central line dressing change. So now I'm going to assess my patient, make sure they're okay. I'm going to clean up my area. I can take off my gloves and perform hand hygiene. Okay, and I can take off their mask if they had one and my mask. Okay, so now we're gonna move on to blood draw, and I'm just gonna sit down so you can see my face. Blood draw and sectioning, I'm gonna verbalize from here. So with the blood draw, again, assess my patient, make sure they're okay, tell them what I'm doing next, explain what I'm doing, and first I'm going to go ahead and perform hand hygiene. And I am going to prime my caps, and I will go ahead and stop all infusions my patient is receiving for at least 1 minute before I draw blood. I'm going to go ahead and clean the cap of the central line, remove it, make sure it remains sterile. I will go ahead and attach my 10 milliliter syringe to the central line, and I'm going to unclamp the central line. I'm going to aspirate to check for patency. Then using my push-pause method, I'm going to flush the line. And then I will draw back blood to use as waste blood. We don't want to use the first blood sample taken out of the central line as a sample for blood that we send to the lab. It could have, the heparin flush in it. So we want to use a second sample we use. So once I take that waste blood, I'm going to reclamp the line, take off the syringe, and go ahead and discard that waste blood in the proper biohazard container. And then what I'm going to do is sterilize the hub with the alcohol swab or disinfect, and then attach my syringe that I'm going to use to draw blood. I will unclamp the line, draw blood, the amount that I need, and then reclamp the line. And then with that syringe, I'm going to go ahead and put it in the proper container per company policy and procedure. And then I will go ahead and sterilize that hub again with my alcohol swab and attach my third syringe to it, my second flush. And I'm going to unclamp the line, and I will go ahead using that push-pause method again, flush the line with a heparin solution or whatever the hospital or my physician has ordered per company policy and procedure. And then once I have flushed that line, I will reclamp it, take off the syringe, make sure that the central line has a new primed cap on it, and I am done with the blood draw. So again, when I'm done, clean up all my supplies, check my patient, make sure they're doing okay, make sure the blood goes where it needs to go, go ahead and put everything in their proper containers, perform hand hygiene. And so now I'm ready to move on to the trach care with my patient. So I'm going to explain what I'm doing. So with my trach suctioning, I'll verbalize this also. I want to go ahead and move my patient into a high Fowler's position if they're not in it already. I don't want them to aspirate on their secretions. And I'm going to go ahead and perform hand hygiene. And first I'm going to check my patient. So I checked my patient when I first came into the room to see or to assess for need to go ahead and suction. I determined it didn't need to be done right away. And I would do that again. And how I would check my patient is by auscultating their lungs. I want to listen for crackles. I'd also look for visible secretions in their trach. And also just look at my patient. Are they struggling to breathe? I would investigate that. I'd also check their vitals and their oxygen saturation. That would give me, an idea of their oxygen exchange. And once I have done that, I've checked my patient, I can go ahead and check the equipment. So my patient is not on oxygen, so I don't have to check any equipment with that, but I will check the vacuum suction pressure on the wall. I want it to be between 100 and 120. And then once I've done that, I am ready to go ahead and start. So I'm going to perform hand hygiene and put on necessary PPE. So gloves, gown, mask if necessary, and position my patient properly. And so what I'm going to do is go ahead and grab my suction kit and my saline. And so with these, I'm going to have my gloves on. This is a sterile procedure, so again, I don't have my sterile gloves on, but I want to be very careful when I'm opening this package. And I'm going to open it all the way and grab the saline cup out of it, just plucking it out without touching anything else. And then I will go ahead and open that saline cup. Once it's open, I can pour my saline into it. Once my saline is in the cup, I can go ahead and hyperoxygenate my patient to 100% with the ampu bag, 5 to 6 breaths for 30 seconds. And then I will go ahead and put on my sterile gloves now that I've done that. So I'll perform hand hygiene, put on my sterile gloves, create my sterile field, and then once I've done that, I will grab the tubing, that's the suction tubing, out of my kit, and I will hold it in my right hand. My right hand will be my sterile hand, my left hand will be my dirty hand. So with the dirty hand, I'm going to grab the connection tubing from the wall, and very carefully I'm going to connect these tubings, making sure this hand does not touch this tubing or this hand, because we want to keep it sterile. So once those are connected, I can go ahead and test that suction by putting it in the saline. And once I've determined that equipment's working properly, the suction is okay, I'm ready to suction. So I'm going to make sure that my patient is okay, and make sure that suction isn't occluded, and I'm ready to begin. So whenever I go in to my patient's trach, I was about to put it through my mouth, through the trach, I am going to go down until I meet resistance, or my patient, not my parent, my patient either coughs or I meet resistance. And so then once they cough and once I meet resistance, then I can turn the suction on, and I can intermittently suction using a rotating movement all the way up and out, back out of the trach. I don't want to do this for any more than 10 seconds. So each attempt I suction is no more than 10 seconds. And I want to then put it in the saline after that first suction to clear that line, clean it up a bit. And then I need to do this same process 2 to 3 times, depending, checking my patient as I'm doing this, seeing their response to the suctioning. Again, each attempt cannot be more than 10 seconds. And then once I've determined that I've suctioned enough, I can dip it in that saline. And I want to, once I've determined it's enough, or before I have done that, I will auscultate my patient's lungs, assess their vitals again, and then I will conclude the order or the procedure. And so then I'm going to wrap up this line, the suction line, in my right hand. I'm going to unhook it, and I will go ahead and dispose of that line in the trash with my gloves. And I'll put the equipment back, and I will go ahead and clean up my table, put everything up, and perform hand hygiene, put up PPE in the proper containers, assess my patient, and let them know I am moving on to the last order, that is trach dressing change. So now that I'm ready to move on to that, I will set up my equipment. So I have my trach tray, and I'm going to perform hand hygiene and put on gloves. So I am just going to keep my patient in their position, and first thing I'm going to do with my gloves is I'm going to look at the trach dressing. So I am going to look at it. I'm going to look at their stoma. I'm going to pull out that trach dressing. The stoma, I want to make sure it's nice a nice pink or red, not blue or purple. The dressing, I want to make sure, does it smell funny or like, too much blood on it or any blood at all. And I want to make sure there's no purulent drainage on it. So I just want to take note of that. And once I've done that, I wrapped up the dressing into my gloves, and I'll take off my gloves. And so now I'll perform hand hygiene. And so I'm going to go ahead and open up my kit. So this is a sterile procedure again, so I want to be very careful when I'm opening up my kit. Only touching the margins, not touching anything else in the tray. Okay, so very carefully, I'm going to touch my sterile gloves. I can touch the outer packaging, and I'm going to place them here, as long as I'm not touching anything else in the tray. So I want to keep it sterile. My gloves are here, and I'll put those on in a little bit. And then I am going to grab the drape, trying to just touch the corners or the margins. So I did touch the back side of the drape. So I want to make sure that I'm putting the drape on the side, the back side that I touched, against the table. So the outer margins of the drape are not sterile, but the center is. The outer 2 inches are not sterile. Okay, so now I'm going to come over, perform hand hygiene if I need to, and go ahead and put on my sterile gloves. So I can touch that outer packaging. So with the sterile gloves, I'm actually only going to put on my right hand first. So I'm going to grab the cuff and step back and put on this glove. So this glove is on. Keep this one off. I'm going to move everything in the trays to the drape in the center where it's still sterile. Okay. And so now I'm going to, with my unsterile hand, or my dirty hand, excuse me, I'm going to touch my saline because it is not sterile, and I'm going to pour into all the containers of the TRACH tray. Pour the saline into each container. And then I'm going to, with my sterile hand, grab the gauze and put it in one of the little containers. And so now I'm ready to put on my left glove. So this I'm going to pull underneath. And put on my left glove. And I'd be very careful not to touch the inside. I slightly put my thumb on the inside of this glove. So because I did that, I would need to start over and grab new sterile gloves, perform hand hygiene, and start over putting new sterile gloves because I can't touch the inside of the glove because it's not sterile. So once I have and maintain my sterile field, I will go ahead and begin. So I'm just going to touch the inside of this. It is still sterile. Move that. And what I'm going to do first, establishing this as my sterile hand, this as my dirty hand, I'm going to take out the inner cannula. So I'm going to go ahead and do that by touching the outer aspect. And so what I'm going to do, I don't want it to just drag over my drape. So I'm going to dip it into the first container. And once I do that, with my sterile hand, I'm going to grab my sterile pipe cleaner and clean on the inside, both sides, scrub it really good, throw this away. Hand still sterile, I can grab the pipe cleaners, do the same thing, get on the inside, both sides. And then throw that away. Do it as many times as I need to, and then I'm going to dunk in that second basin. And I want to be very careful not to touch this at all. It can touch the outer 2 inches because it's not sterile, but I don't want it to touch past the 2 inches or anything on the inside, or I don't want it to push it off the table. So we'll dunk that again in the second basin, and then I will grab gauze, wipe it off if I need to, and then give it a little shake. And again, don't want to drag it over that sterile field. If I did this again, this would be right here. Bring it back over, keeping my hand on the outer aspect. Put it back in. Okay, and so it's no longer a sterile procedure anymore, but I do want to take my gauze that's dipped in saline, and I'm going to clean around the trach, and I'm going to clean, throw it away, and then I will grab my little Q-tips and I'll dip those in saline, and one at a time I'm going to clean underneath the faceplate, get underneath, you know, the hard to reach places around the cannula, throw that away, do it again, throw it away, as many times as I need to until it's nice and clean. And then I'm going to pat it dry if need be with my little gauze. And once that's done, I'm ready to go ahead and put on my new dressing, the fenestrated dressing. And very carefully, I don't want to yank the trach, I don't want to yank the cannulas. Just very carefully place this underneath the faceplate. Okay, so now it is in place underneath the faceplate. And so the last thing I need to do is go ahead and change the ties. So this part I will verbalize. So with the ties, I want to keep the old ties on until the new ties are completely on and secure and checked. So with the new ties, I'm going to put it around my patient's neck. I'm going to secure both sides of the faceplate, and then I will check with two fingers underneath. I want it to be nice and snug with 2 fingers. I don't want it to be too tight or too loose. That's how we check. And then once they are secure, ready to go, I can take off the old ties. And then that concludes my central line and trach care. I will again check my patient, make sure that they're okay. I will go ahead and clean up everything. And sanitize tables, take off my gloves, perform hand hygiene. I'm going to go ahead and put my patient's bed all the way down, handrails up. I want make sure that there's new suction equipment on their bedside. Make sure that the call light and their personal possessions are within reach. And then on my way out, I'm going to go ahead and perform hand hygiene, and I'm going to document everything I did, my patient's reaction, and then I will check on my patient routinely. Thanks.